Hey guys, what's up? It's me here in November. Welcome back to I Know Advocacy. If you do not know, I'm November. I advocate for psychiatric survivors' rights. I live with multiple mental illnesses, including schizoaffective, borderline personality disorder, and PTSD, and maybe autism. But today I'm going to talk about, I was in the hospital 2 times actually. So I'm going to tell this story and kind of what went down and stuff like that. So I know the last video I posted, I was taking a break. I feel much better. I am fine right now. I'm okay now, so don't worry about me. But 2 Sundays ago, I hallucinated from 8 hours. I hallucinated from like 4 o'clock at night till 12 o'clock midnight. And I went to the ER around 8 or 9 because it was really intense. And they gave me Valium and Xanax. I did not sleep at all. And then they transferred me from the ER here in Atlanta. They transferred me like an hour and a half away at this psychiatric facility called Riverwoods. And make sure it doesn't have any like confidential information on it. They gave me this journal here, which is filled of papers. So we're going to go through it. But they got me there for psychosis, and they 1013 me, which is an involuntary psychiatric hold, and they put me there. And so I'm going to talk about my experience there and why I ended up in the ER yesterday. And I am fine, by the way. Okay. So I've made videos, like, if you want to know what a mental hospital is like, this isn't the video to watch. I have other videos like that, but I'm not going to rehash it. But I am going to say some pros and cons of the hospital. So out of all the hospitals I've been to, I like this layout of this hospital the best. Let me explain why. So, at Riverwoods, let me explain. I went there back in 2019, and they used to have a men's side and a women's side, and they had a wall between the nursing station and the women's side. We were cramped in this little room, which I did learn after like 4 or 5 days being there that I was on the acute unit, which means severe. They seem to put a lot of people with psychotic disorders on the acute unit, which they didn't even treat they didn't even have groups about psychotic disorders or what to do with hallucinations or delusions, which really irked me because, like, I have a feeling in just talking to some of the patients that most people were there for psychosis or schizophrenia, and they're just talking about depression and anxiety. It's like, that's great. We need that too. But if you're on a unit with psychosis, you need to be talking about coping skills. Anyways, the layout of this place was, they took the men and women's side down. There's a big day room. There's a door that goes outside. There's a nursing station, which is open, which Summit Ridge, another mental hospital, does not have an open nursing station. And then there's the therapist's office, and you could actually knock on the door on the therapist's office. Now, they may not answer, but you can knock, and like if your doctor's up at the nursing station, you can go up and ask a quick question if they're not seeing you, like ask if, when are you going to see me today, and stuff like that. So, and also when we went outside for like smoke breaks, which I don't smoke, you could go outside or inside. All the other hospitals is like everyone has to be outside or everyone has to be inside. Now, yes, the outside door was closed unless it was outside time, but you could go outside or inside. It really was a nice layout, in my opinion. They were really lenient about a lot of stuff. We went, well, sounds bad, but I made some friends there, and we went in the other patients' rooms. What would happen is they would lock, so the women's side, they would lock all the doors except one room door, and you couldn't go in your room during the day. So they'd lock it, unlock it to use the restroom. And so this one patient, oh my gosh, I'm not going to mention her name, but she was a nice person, but every room that was unlocked, she was sleeping on my bed, and she was like conked out. Like she was on, I don't know what her story is, but she was just like completely conked out on the bed. And it was like, wow, you're really tired. But, like, if a room was open, me and this, I'm not going to mention anyone's names, but me and the, couple of my friends there would go in rooms and just, like, talk to get away from the craziness of the units. The food, I know this isn't the most important thing when you go to a psychiatric hospital, but it does help. The food was really good. It was, like, restaurant-quality food. Now, the only complaint is they had the same breakfast every day. It was sausage, pork or turkey sausage, eggs, grits, hash browns, and a biscuit, except, not hash browns, oatmeal. Eggs, grits, oatmeal, and biscuit. Now, one Sunday I was there, the only Sunday I was there, they did have bacon and French toast. But other than that, the food, really friendly. They have, like, 2 options each day, like 2 entree options. So if you didn't like one, you could choose the other. You can bring your pillows and blankets out into the day room. They didn't really care. Like, one staff got a little panties in their wad about it, but most of the staff didn't care. They let me keep my wig. I had on a different wig, but they let me keep it until this lovely story of one of the nurses, not going to mention her name, But I come up, this is like a week being there. I come up to my meds. I'm like, I say my name, and she's like, what's on your head? I'm like, it's a wig. And she's like, take it off. I'm like, they let me have it for a week. And she said, no, it looks hideous. Take it off. What? Why would you say that to a patient? Who cares? And I was at the end of my stay, and I was just like, it's your opinion. You know, you're entitled to your opinion. Whatever. I like it. Okay, so now let's talk about the negatives, and we'll get into why I went to the ER yesterday. Oh, another positive. Unlimited number of clothes. Some places only let you have 3 outfits. They let me have like 6 or 7. I had like 4 that I brought in, and my friends brought me some. Okay, so cons. Some of the staff had really bad attitudes. I would say like 60 to 70% of the staff were just lazy. I don't think they're horrible people or anything. I just think they're really lazy. You had to go to the gym every day, which was like sensory overload for me. The ball was bouncing. It was like 10 a.m. I was still tired. Ball was bouncing, music playing, someone screaming one time for 30 minutes straight. Okay. Oh my gosh. They diagnosed me with 4 different things. So if you don't know what schizophrenia and schizoaffective are, I'm not going to explain in this video. There's other videos of mine you can go watch. But basically, so when I got there, they said it was schizophrenia. Like the initial diagnosis, because when you go to a psychiatric hospital, they have to diagnose you something for insurance purposes or you can't be there. The initial diagnosis was schizophrenia. Then I saw my doctor. He said schizoaffective and borderline personality disorder. And then I saw another doctor, schizophrenia. Another doctor, schizoaffective. I'm not making this up. When I saw the therapist, it said MDD of psychosis on the sheet that she gave me to sign. It's like, you guys don't, and another thing that really annoyed me is I saw 1, 2, 4 different doctors or nurse practitioners while I was there. I saw a nurse practitioner. I don't know if she's a doctor or nurse practitioner, to be honest. I saw like for 3 days, and then they switched over to a different doctor, and I saw her, her colleague or whatever. Okay, so why I ended up in the ER. So this is where I talk about medication. So they put me on a med, and I have this written down somewhere. I don't know what oh, here we go. Okay, great. Med list. So if you don't know much about Clozaril, which I'm not an expert, so do not take this as medical advice, contact your local psychiatrist. I did not know much about it. It's a medication, it's an atypical antipsychotic for treatment-resistant schizophrenia or schizoaffective. So, but the doctor there told me that, Dr. Foxworth, he told me that you have to draw your blood initially when you do it, and then I don't remember if he said once a week or every other week or something like that, but he said you have to get your blood drawn. I was like, yeah, I'm fine, you know, I've really high pain tolerance. So that was that. He put me on Clozaril, Lexapro, Cogentin. Okay, let me see what these are for. The Clozaril is for schizophrenia. Cogentin is for side effects from antipsychotics. Lexapro is for depression. Lithium's for mood. Minipress is for nightmares. Visceral for anxiety. Zyprexa for psychosis. So they put me on all this, but this is the problem. He first said he was going to put me on Clozaril and wean me off Zyprexa. Next doctor, Dr. Blessing, not sure if, I called her Dr. Blessing, but I'm not sure if she's a nurse practitioner or not, because she was from another country, so I don't know if she was a doctor there, a nurse practitioner. Who cares? She said she was going to put me on Seroquel and wean me off. She says you can put me on Seroquel. Then a couple of days later, she saw me, she's like, why are you on 3 antipsychotics? I'm like, I don't know, you prescribed them to me. She's like, no, I'm going to wean you off the Seroquel. So she put me on it, and then she weaned me off. And then she kept me on the Zyprexa. I was on lithium, and I felt fine. They drew my blood, my white blood cell count. Oh, Clozaril has a tendency to lower your white blood cell count, but at the ER, the normal people ER, it was over. I was high white blood cell count. When they did my blood work at the hospital, it was high again, and I actually got a call on my roommate's phone when I was home. And they said that my white blood cell count was high. But then they checked the ER and they saw the ER. So, okay, so I'm on all this med, right? So then I feel a lot better. I haven't hallucinated in like almost 2 weeks now, which is, let's hope that continues. But I saw my normal psychiatrist yesterday, and I told her I felt a little dizzy. Well, I've been feeling, I get high anxiety. I don't know if I'll make a video or not, but I'm really anxious about dying, you guys. I don't even know if I'll make a video about that. But, anyways, Gosh, what was I? So I told my normal psychiatrist I was on all these meds. She's like, okay, Clozaril, you have to get your blood drawn once a week. And my insurance that I have is only for hospital. It doesn't cover blood drawn and Clozaril. So, anyways, she's like, that's way too much lithium. You need to go to the ER and get your lithium levels checked. So I'm freaking out, and I'm like, what if there's too high? And she assured me that even if my lithium level was toxicity, that she could, prescribe, that they could give me stuff at the hospital to get it down. Well, I went to the hospital yesterday, freaking out, was there for 4 hours, and they tested my lithium. My lithium is fine. It's a little, it's not elevated, but basically when you're on lithium, they want you to be at a therapeutic dose, which is higher. Mine was 0.20. So, if you don't take lithium at all, your lithium level is 0, but it wasn't high. It wasn't of any concern. So, I am fine. I am back home. I'm going to see her on Monday because I freaked out when she said go to the hospital, and I didn't really listen to anything else she said, but I'm seeing her on Monday to talk about medication. So that is my story of going to the mental hospital and then going to the ER right after. And this is just to say that, and I've told other people this, when we're in a psychiatric hospital, this is not some stimulation in med school where you can just prescribe people what they want and see what happens to them. These are real people with real brains and real lives that are affected by the side effects of medication. And I do feel like Dr. Foxworth, I really wish he would explain more the risks of being on Clozaril and lithium, because I didn't have my phone. I couldn't do research, but I went home and I found that Clozaril is actually banned in Finland because so many people have had complications and deaths from it. And now, I'm not saying never take Clozaril. Of course, consult your psychiatrist, but make sure you do your own research and assess the risks of all these medications you're on. But, yeah, so that's what I have to say. I'm back to normal. I'm going to pump out more content. I don't know what, but thanks for listening. If you guys want to, you can check out my Linktree and follow me there. Bye.